Hi everyone, I'm Doug Beal. I'm an interventional musculoskeletal radiologist practicing in Oklahoma City. Whenever dealing with a patient with SI joint pain and all of the previous conservative treatments, physical therapy, rest, analgesics, medications, so after these are exhausted, we often turn to things like SI joint injections, where we inject directly into the SI joint. SI joint radiofrequency neurotomy turns off the sensory nerves to the joint, and that's usually effective for about 6 months, maybe up to a year. And after that, we often will fuse the SI joint. The SI joint, and if you're scared of fusion, if fusion sounds a little bit dramatic, keep in mind that this is not a joint like a knee or a hip. It moves about 1 to 3 millimeters on the average. It doesn't move very much. It just moves enough often to hurt. There's been studies that show the movement with somebody that has SI joint pain versus the movement of somebody that does not have SI joint pain is exactly the same. So we detect this with a combination of injections, injection test, and the method to treat the patients. We often will do the injection. That will tell us if the patient has pain or not. We combine this with physical examination test for determining SI joint pain. Things like a sacral thrust, pelvic compression, pelvic distraction, Faber's test, Gainsland's test, and Fortin's test. So all of these will determine. So we have a diagnosis that's a combination of physical examination test and an injection test that tells us whenever we need to go ahead and move to a surgical treatment, a fusion. And the fusions that are done minimally invasively, and it's a very elegant, small incision with virtually no downtime. So once we decide, again, this is 15 to 22% of people with back pain will have this, so about between 1 in 5 and 1 in 7 patients will have this. This is as common as blue eyes in the United States. So this is not unusual at all. So once we determine you need SI joint pain, if you have exhausted the forms of treatment that are more conservative and less invasive, then we can proceed on to an SI joint fusion. Thank you for your attention.